All right, guys, welcome back. Guess this is the final installment of our virtual meeting here. I'm glad a lot of you decided to stick around. Hopefully you're not disappointed in listening to me talk. But for those of you that don't know me, again, Nate Olson, I'm the Executive Vice President of OCI here, and I oversee our individual lines of coverage. So what I'm going to do today is kind of go over just some need to knows for open enrollment and a few things that maybe you guys should be looking at just from an agent standpoint. I will answer questions here at the end. So again, just like we did in the other sections, just go ahead and ask your questions and I'll try and get to those here at the end. So with that, I'm just going to go ahead and jump right in because I know you guys are probably tired of sitting here listening to webinars all day. So first and foremost, what are some of the things you guys need to be doing for open enrollment prep? First and foremost, you need to make sure that you are certified with the marketplace. Going to the CMS website, completing the certification. For those of you that are returning, you'll find that was a very simple process this year, just a few clicks. Very simplified as it was from last year. For those of you that are new and looking to get certified, that training is not available just yet. And from what we were told by CMS is it probably won't be till mid-October. So nothing like the last minute to try and get your certifications done. But if you've already completed your certification, again, we do not need copies of your certifications this year, but we do ask that you verify that you're on and registered with CMS. And you can see right here, there's this link that we provided. And when we send out the slide decks, you'll be able to copy this down if you don't have time, but you can actually go in there and type in your NPN and it will actually show you if you completed your marketplace training. So this is what the carriers are using to get compensation generated for you. So they're going to make sure that you show up on this list. If you're not, you will not get paid. So make sure that you are on this prior to open enrollment starting. So you can kind of see right here, this was my NPN, the year that I completed it, and then it shows exactly when you actually did it. So I would highly suggest all of you that have completed it to go in and just verify that you are on this registration list. Some legislative updates. I know some of the other carriers already talked about a few of the things, but I just want to make sure to emphasize some of the stuff that they did. First and foremost, the removal of the federal poverty line cap at 400%, which means basically a lot of those people that kind of fell right outside of that 400%, maybe to that 600% that might have been high candidates for the short-term medical, now will apply or will be eligible for some of those tax credits. I know some of you went back in throughout the year and recalculated those tax credits for your consumers and got them the savings right away. For those of you that didn't, at the end of the year, it will be reconciled on their taxes. But you could see a pretty big increase in those tax credits here at the end of going into 2022 when you go to reapply for a plan. Open enrollment was also extended. So they did extend it a whole month out to January 15th, 2022. Another thing that came about was year-round special enrollment period for individuals that fall below the 150% of the federal poverty line. So basically that's open enrollment all year for those people that are under that 150%. Another thing that some of you are aware of, and I would be shocked if a lot of you didn't know this, but compensation disclosure is becoming effective December 27th of this year. What does that mean? Well, basically, we now have to disclose to consumers what we are going to make when we sell commissions through the individual lines of coverage. Just on the medical side, this doesn't affect Medicare or some of the supplemental lines at this point, but short-term and major medical, we will have to disclose compensation as of that date. So what does that mean to you right now? I don't actually have an answer. The latest regulations that just came out said that is up to the carrier to disclose those fees that the consumer would have. And basically it has to say how much you're making, and that can also be any bonuses that you might be eligible for and any non-monetary things. So any trips or things like that that could be eligible. Golf outings. I mean, it's that detail that they're saying that they have to make knowledgeable to the consumer. And the whole reason is they wanted to make sure that consumers were aware that if agents were trying to push another carrier over another, that they weren't incentivized to do that. So When I spoke with most of the carriers, the four main ones here, none of them actually have an answer to how they're going to disclose that just yet. I know NAFA and NAHU, they are trying to get this pushed back to after the first year. It's kind of a horrible timing to try and implement something right during open enrollment. So we'll continue to keep you posted as we find out, but just something I think you guys need to be aware of. Some updates just for 2022, the cost share limit. So that's the maximum out of pocket for an individual is being going to $8,700, and for a family, $17,400. And then of course the HSA limits are increasing again this year from going up to $3,650 for an individual, $7,300 for a family, and then that extra $1,000 for people that are over the age of 55. Going to go through some of the market updates again. I think of what a lot of what we just heard kind of tells you a lot of the updates that are coming, but of course we do have two new carriers coming into the market, Ambetter and Oscar. OCI is super excited to partner with them as a GA, and that helps us add just some additional options for our consumers in addition to what Medica and Bright are already bringing to the table. From a market overview standpoint, as it stands, of course, we only have two carriers right now, and I kind of wanted to give you an idea of what their percentage increase was. Medica overall, again, this is across their all of their different plan designs. They're asking for a rate increase of 10.21%. Bright Health is only looking for a 1.31%. So again, that could be a little bit different because Medica, I believe, on their limited network plans are actually seeing very little increases, but maybe on their insure plan, you might see it a little bit higher. Yeah, on the insure plan, you might see a little bit higher. So just from a makeup standpoint, I mentioned this earlier, but Medica does make up 82% of the individual ACA market. So with those two other competitors coming in, I do think you'll see a little bit of a shift and then possibly lose some of that market share. Again, a lot of that's going to come down to pricing and who that lowest cost silver plan is. Based on what I just heard, I think Ambetter will probably be the lowest cost silver since they're not using a rental network and have a very limited network plan that they are building out. So that will be interesting to see, of course, when that window shopping becomes available here at the end of October. Another interesting stat, average premiums in Nebraska on the marketplace are $53. That's down 51% from $109 since the start of the American Rescue Plan Act. So a lot of clients are saving additional dollars with those increased subsidies. And I'm going to touch a little bit more on that later on how you guys as agents should be helping your clients maybe reinvest those savings, maybe in some additional product lines to help better protect your client and also put a little bit more money in your pocket too. So 48% of new consumers during the American Rescue Plan Act selected a plan for $10 or less. That's a pretty amazing statistic. 33% of returning consumers, so they went in and reselected and reran their tax credits, also selected a plan for less than $10. From the time period of February 15th to July 31st of this year, just shy of 14,000 people chose to enroll in new plans. So a lot of movement there just between the two carriers. So one of the things that I know Oscar touched on quite a bit and that we're really going to be pushing this year, I know we've kind of toyed with a few different ones last year, and I know some of the agents here on this webinar have used these over the last few years, but for those of you that aren't aware, Enhanced Direct Enrollment, otherwise known as EDE, is definitely something you should be taking a look at if you are doing anything in the ACA market. I think first and foremost, it's a great way to stay compliant. You're actually able to access all of your clients' applications on the back end versus having to take their username and password. And if you've done any of that CMS training, that is not something you are supposed to have as their username and passwords. But this actually allows you to log in as an agent and backdoor into their applications to help them apply for the subsidies and ultimately enroll in coverage. It allows you to not only quote compare, you can track, you can enroll everything that you've done through the ACA, through the marketplace, all in one single location. You can view all your enrollment details. You can pull up plan documents. You can pull up SBCs, brochures, provider networks, RX searches if those are available. You can also access subsidy notices and tax forms. I know that's one of the big things that was kind of an issue, that if you were using some of the other enrollment platforms, you didn't have access to those subsidy notices, or you didn't have access to your tax forms, and you were kind of had to tell your clients, hey, when tax time comes, you need to contact the marketplace to get those. And while you can still do that, this is just another value add on that you can actually provide. Another thing that was, maybe updated here within the last few months is you can actually upload verification documents and track the status of those. So if they're asking for income verification or citizenship status or any of those documents that you have to upload, you can actually do it as the agent, and then you can actually track the status. So it'll actually tell you if those are approved and send you an email letting you know that those have been approved, or if they've been declined and you need to provide additional information. From an agency standpoint, you can actually set up an account and have all your downline agents. So you could log in as an agency and track all of the production that your sub agents are producing through the website as well. In addition, you can also have one person be the primary NPN. So if you have multiple sub agents underneath you and you want them all writing under the head of the agency's NPN, you have the ability to do that. There's just a few things that you have to do upon setting up the account, and we can help walk you through exactly how that's done. But again, a nice feature for those agencies that want to track how their downline are producing. It also has self-service capabilities. So if I don't, let's say during busy season, there's only so many hours in the day. I've got so many clients I got to speak to it, and I don't want to miss out on those clients. You can actually have maybe in an auto response email or something sent out, or you could do some marketing campaigns where you can actually have a self-service link that codes all of your agent info in. So it codes your NPN, and the client can actually go in, shop for a plan, apply for the subsidy, and select a plan and enroll, and you get the credit for it. And it would actually show up on your dashboard as well. So maybe for some of those people who are a little bit more computer savvy, or looking for a way to if they can't get a hold of you and they still want to maybe enroll in a plan through you, this is a great way to do it. They can even go through and apply for the subsidy and then just put it on hold, and then they could actually talk to you about how they wanted to, or which plan would be best for them. With so many options out there, I think there's going to be a lot of questions, but you could have them do some of the preliminary work and filling out the application and the subsidy part, and then you can just help them enroll in the actual plan online. One of the other nice features that the ED provides is upon you submitting an application and enrolling them, the client gets an email notification saying, hey, you've been signed up for a plan, and they can actually log into an account where they can see what plan you've enrolled them in, what their premium is. They can pull up provider searches, brochures, SBCs, all of their tax documents. So it's a nice client portal for them to log in to see anything related to their health insurance. So I know that's super helpful for a lot of agents that might have been doing that manually, taking a screenshot of the marketplace and then attaching plan documents and links to all these different things. This is just an automated response that gets sent upon submission that your client then receives. So a very nice feature there. One of the big things is it doesn't cost you anything. So I know some of these ED platforms, one of the ones I know a lot of the agents used last year was INSX. They were charging anywhere from $3 to $5 per application. This is actually free, and you do not have to have your contracts through them. So all of your contracts are still housed through OCI. 100% of the commissions are still paid to you. It's just something to streamline that and create some more efficiencies for you and your clients. If that's something you're interested in, I'm not going to go into detail exactly how Health Sherpa works exactly, because I think that is something in and of itself. So we're going to be sending out some additional webinar information on Health Sherpa to actually walk through the system for those of you that are not familiar or would like some more information about it. So if you are interested, you can definitely reach out to us or keep an eye on your email. For those of you that are already set up, we do ask if you can go into your settings page and add OCI as your upline. You can see there our upline code is 43F5. What that does is it actually allows us to help you track your business. We have a hierarchy view where we can view all of our downline agencies and agents. And when you guys complete enrollments, we're actually then taking that data and dumping it into your OCI account so that we can start tracking for commissions. Whereas in the past, we either had to rely on you guys to let us know what you guys wrote and what carrier, and then we could find all that. But here we can pull everything that we need to enter into your OCI account, and then we flag it to start watching for commissions. Because I think you guys all know as well as we do that sometimes the carriers might miss a few there that you did. And if everybody's using a system like this, we can hold them a little bit more accountable. That's it on there. I'm going to see if there's any questions here real quick. Give me a sec. So I had a question. The year-round open enrollment only applies to 138% to 150% of FPL since Nebraska expanded Medicaid, correct? That is correct. Is the new FPL table available to use with plan year 2022? It is available. We can get that out to you guys here as a follow-up. With the new EDE, can we access their 1095As? Yep, you can definitely do that. That's their tax forms there at the end of the year. I'm assuming you can report life changes through EDEs as well. Is that correct? Yep. So you can actually go in and make life changes, update income, remove people, add people. You can actually cancel plans through the EDE platform. So it's a full robust tool. Let's see here. Does the EDE account platform help with the issue of having to have the client reaffirm their choice to keep us listed as their agent and give authority for the marketplace to speak to us on their behalf when problems arise with the re-enrollment? Unfortunately, that does not. So CMS does still require that that the client calls in to give you authorization to speak on their behalf. I know we have somebody here internally who does sit on CMS calls here, I believe, every other week, and that is something we continue to push. I know that that's an issue for all of you, is trying to call in and help them, and you're not listed, and then they've got to go through that whole cycle to get you added on to then speak to them. But unfortunately, the EDs do not fix that problem. Can client information be transferred from INSX to Health Sherpa? Absolutely. If that's something you are interested, I'd ask you to please reach out to myself or Ashley Larson, and we can help you get those clients imported over there. Can OCI create a cheat sheet, including contacts and websites for all the new vendors, including things like who has reciprocity embedded or not, etc.? Yep, we will be working on some cheat sheets as soon as that information becomes available. We just want to make sure we actually have the stuff from the carriers before we create any of that. So looks like that's all the questions. So I'm going to go ahead and keep moving along here with the presentation. So a lot of questions have been asked about short-term and where we see the future of that going. You know, as it stands right now, you can still get 1 month up to 3-year plans. There is nothing restricting that as of yet. I do think that that will come in short order with the new administration, I guess newer administration. We do feel that that will be something that comes under attack here. Probably end of Q1, beginning of Q2, just kind of based on what some of our carrier partners are telling us. So, you know, short term is still on the table. And what I would tell you is if you have any clients that are interested in short term, have them get it now while they still can. You know, the last thing you want is, oh man, they would have been a great candidate for short term, but now we can't get it anymore. And you can only get it up to, you know, a 3-month time period. And then you've got to wait 1, 2, 3 months before you can reapply for another one. I know that's some of the legislation that's going around, is that it truly wants to be, they want to make it truly only for short-term purposes and not the longer time frame. So I'll go a little bit more into the short-term plans that are still available and some of the things that set them apart. But yes, that is still available. So again, our carriers that we partner with, National General, United Health One, and Pivot Health. So looking at the 3 different carriers, they'll have a few things that maybe set them apart a little bit. I do have Blue Cross. Somebody asked, do we have Blue Cross Armor? Yes, we do have Blue Cross Armor. I honestly didn't even think of them. We just don't see a whole lot of them. Take that for what it's worth. I think from a benefit standpoint, I think these carriers have better options and a little bit better pricing than what Blue Cross can offer personally. So National General, they've got coverage up to 3 years, and you also have the ability to lock that rate in for 3 years. So I know that that's something that a lot of agents took a look at maybe 1-2 years ago. Maybe might be something you want to take a look at a little bit closer now. If you did have somebody with National General that maybe you wrote 1 or 2 years ago and you wrote them on a 3-year plan, the nice thing that they actually allow you to do is go ahead and rewrite it. So I could go ahead and write a client that I wrote a year ago on a 3-year plan. I could actually rewrite them January 1st for a new 3-year plan. And National General will go in and cancel their old plan automatically and set them up on a new 3-year plan. That way, you're extending for them to have that short-term option for a few more years out. And you can lock in that rate so there's no surprises come year after year. They do offer child only. They do have to be 2 months or older. They have a 20% discount if you pay the premium in full for the year. On top of that, you can get another 20% discount if you are eligible for their preferred rates. So up to a 40% discount if you combine those two, which is a pretty significant difference out there. Starting October 4th, you will be able to quote those short-term plans 90 days out. So you could really compare those to, what the ACA plans are when those become available to see, what might be a best fit for your client. And from a network standpoint, they use the Aetna or you can select the Aetna or Cigna PPO option. So United Health One, again, also has coverage up to 3 years. If you are already a member of theirs, you do have to wait, I believe it's a month before you can sign up for another plan. So they don't have that feature like National General does where you continue to keep riding that and push it down. They do not offer any child-only plans. They also include a 20% discount if you pay the annualized premium in full. Their TriMed plan covers RX coverage. There's some copays on there and subject to deductible and coinsurance, but is not included on their value plan. They've got some great product bundling, as does National General, but I'm going to touch on that here a little bit later. And they use the United Healthcare PPO. Pivot Health, also coverage up to 3 years. One of their big standouts is they do have coverage for collegiate sports. So as long as they're not being paid, now I guess with the new college rules and how they can receive dollars for their likeness, I guess I haven't thought of that until just now. But that is something for those kids that are playing sports. So you do have some coverage on that short term. They do child only for 2 years and older. One of the things that I thought was unique with them also is they have free and unlimited telemedicine benefits. So similar to Oscar that we saw earlier, they do have that as an option on their plan, or excuse me, included in all of their plans. And then they have the Cigna PPO, or they also have an open access network where you can basically go wherever you would like, and they'll discount it on the back end. And they did this year add an option to add dental and vision onto the plan. So, one of the things we talked about a little bit earlier was the amount of dollars people are eligible to save with the additional APTCs. And I think what a lot of agents are just, unfortunately, what we're seeing is that they're saving their clients money, but they're not trying to see if there's anything else they might be able to assist them with. So, on that stat where they're saving 51% on average from what they were paying prior to if they're eligible, I would highly suggest that you look at trying to cross-sell them with a line of products. And, I've listed a few here, and you may have some internally that you guys use. But this is a great time to better insure your client or give them something that maybe they couldn't afford before. If they were already used to paying a set dollar amount and had it already built into their budget, why not take a look and see if we can better cover them? If they're on some of those higher deductible plans, an accident plan would be fantastic to help offset that higher out-of-pocket cost. Dental insurance is something a lot of people are asking for, and I know a lot of, my stance is to pay it out of pocket, but there's so many people asking for it, you shouldn't be walking away from those type of options. Term life insurance, there's a ton of people that do not carry enough life insurance on themselves or their family. What a great opportunity to say, hey, I know we freed up some of that money. Let's take a look at some term pricing and see if we can get some life insurance for you and your family. Critical illness, in case of cancer, heart attack, stroke, it pays out lump sums to them that they can use that money however they want. and telemedicine. You know, if you're looking at those short-term plans, I think when we were going through all the presentations have some sort of telemedicine, but if you're looking at short-term, adding on telemedicine to really make that a more robust plan might be something to take a look at as well. And the nice thing about these is, you know, compensation can be, you know, up to as high as I think 50, 55% on some of them, depending on the carrier. So, you know, where some of these carriers may not pay as high of commissions, it might be a great way to offset. Again, I don't want to make it sound like I want you guys to jam additional products down your clients' throats. Of course, you always want to do what's best for them, but they may not even know that these options are available. And I think it'd be a great opportunity for you to bring them up at this time. You know, one of the things that I really like about National General and some of the new features, if you've never been on their website, they've done some pretty big enhancements over the last few months. When you go on and log into their website to run a short-term quote, they actually have loaded in the on-exchange carriers. So you can actually now compare short-term plans and health on-exchange plans with their tax credits applied to really see if there's an option for them. So I can build a short-term plan with some ancillary product lines, or, you know what, if ACA truly is the best option, I can build the ACA plans, but I can also add on supplemental lines here as well. So where we were talking about using those savings and trying to reinvest those in some additional lines, National General makes it extremely easy for you to do. So you can go in here and you can quote the short-term plans. Then I can take a look at what those ACA plans, so you can see we actually put in a family member of one and a household of 40,000, and it recalculated those tax credits. So I could actually come in here and pick a Medica plan, for instance, and then I could add on a dental and an accident plan to really build a packaged product. So let's get away from trying to be these order takers and trying to come up with a packaged solution that we think is going to be best for our clients. And National General has made probably one of the better platforms that I've seen to be able to do this. So you can see on this specific example, I added on for the Medica plan. You can see right here for the $147.37 a month. I then added on a supplemental dental plan through National General for $33, and then I added on an accident plan, and it cut it off. But you can see I've now got a package solution for them to take care of this individual's needs for $201 a month. And when I go in, I can actually then create a proposal which labels all that out for them. So now I can give my client a presentation or the package showing their on exchange or short term, whichever one you decide to go with, along with the ancillary. So what you can kind of start doing is find out what your client's budget is and maybe back working into finding them a solution, you know, messing with that deductible range either on the short term or the ACA, and then offsetting that with some supplemental lines to offset maybe some of those higher deductible shifts you have to make to save and lower those premium amounts. So again, it's a really cool feature. If you're not set up with National General, I would strongly advise you to get a hold of us here at OCI to get set up. I was talking with Andy, who's our local rep, and they're actually going to be implementing their own enhanced direct enrollment platform as well. So you would actually be able to apply for the Medica on exchange plan as well as the supplemental plans at the exact same time. As it stands today, if your client wanted to move forward with this package, you would have to use, you know, Health Sherpa or another platform to enroll them in the Medica plan. And then you would do the two National General plans on one application, but you'd have to do that through their site. So I think once they get that EDE capability up and running, that's going to be a great option to really boost your ancillary sales. One of the other things that we are pretty excited to talk about is something called Cleverrx. Basically, it's a way for agents to promote an RX discount card and get paid for any time a client uses it and gets a script filled. So Cleverrx, think of it, I'm sure a lot of you have heard of GoodRx. Well, this is Cleverrx. I don't know how clever that naming was, but basically what it allows agents to do is set up their own discount card program and hand this off to their clients, and they can use it for, you know, ACA clients, short-term clients that maybe don't have any prescription drug coverage, Medicare clients. And basically, it gives each of your clients a link that ties back to you. And this is a free program that your clients can use where they can go on and search for drugs, search for local pharmacies, and ultimately get a prescription filled with maybe a discount voucher. And every time a client gets a prescription filled, you earn $1. Now, I know $1 doesn't seem like a whole lot, but if you got a bulk of your clients using something like this and maybe filling a few prescriptions at a time, it can definitely add up. Your clients can also then share their card with their friends, and if they fill prescriptions, you get $1 off of that as well. So it's just another unique thing that you could bring to the table to help them save on prescriptions, because I can tell you that sometimes your insurance isn't the cheapest way to get your prescriptions. And I've got a story that I'll tell you about here in just a minute on how exactly I just used this just recently for a prescription that I had to get filled. So basically, you can download an application on your phone, you present it to the pharmacy, they charge you that price that's on that card, and then you get the dollars on the back end. So this was a couple screenshots that I took. Now, this wasn't my exact instance, but this was kind of how I used it. So what you can do is you can pull up the Cleverrx app, you type in the prescription you're looking for, so that's on this left side screen here, type in what, the form you're taking, the dosage, the quantity, and then you type in your zip code, and it'll actually spit out the closest pharmacies and all the prices right there. And you can see for this particular drug, Walmart Pharmacy here in 68022 here in Elkhorn had the cheapest price, and it was for $4. So I could go in, I would click that Walmart button, and then it gives me this little voucher here. So when I go to the pharmacy, I give them this, it gives them the BIN number, the PCN number, the group, and the member number so that they can get that $4 price, and they're gonna pay that right there. So again, this is going to be outside of your health insurance benefits. So you're either going to use the Cleverrx discount program or you would use your health insurance. So for instance, over the couple weeks ago, I had to go and get some eardrops. I used the Cleverrx application, and I went in, and it was to, and I believe it was Walgreens, because I was the only one open at the time. When I gave them my insurance card, it was $68 and some odd cents. When I actually used the Cleverrx app, it was $25.32. So I decided, well, I don't necessarily need to turn this into my insurance. I'm going to take the savings and use the discount program and save the dollars. Now, yes, that doesn't apply towards my maximum out of pocket, but I'm not one that's likely going to meet my out of pocket. So I was okay with taking those savings right then and there. So again, I think it just takes a little bit of education with your clients, but something that's really neat out there. I know a ton of you guys out there use GoodRx, but this is just something that you can use where you actually get a little bit of a kickback every time they fill that drug. One of the other things that's up and coming here in Nebraska is the Department of Insurance is having some events. They're called community discussions. You've probably seen some emails through it, but they're going to be calling on the communities to look at certain areas. You can see on the right side the dates and locations of all the different events they're doing. But what they're trying to do is get the word out there to talk to consumers about the new options that are available here, what premiums might look like, Medicare, proper marketing of health plans, common questions that people might have, how the Department of Insurance can ask, or how they can help. They are asking if agents are able to make it. They would love to have you guys there as well, not only as a resource, but maybe a client needs to look at some coverage, and if there's some agents there that they might be able to refer them over to. You also receive two free CE hours just for attending. So when you go, you just give them your name and national producer number, and you'll get 2 free credit hours. So those all run 2 hours. So I just have the start times there, but they all run 2 hours in length. So one of the other things we're really excited to announce, we're going to be having some big update changes to your OCI account. We've toyed a lot with the user interface of how you log into your OCI portal. And we just kind of restylized it, made it a little bit more user friendly for you to find the important information that you need, and really trying to tie in all the different systems that we use, whether it's Health Sherpa or on the group size ease, commissions. We're going to be posting the commission schedules out there. So we really want you guys to have everything at your fingertips, and we'll be looking for your feedback once we actually release it to see if there's any improved enhancements we can make. So this is kind of phase one of a big approach that we're taking for you guys as a tool for you guys to help you run your business on the back end. So with that, that's about all I have. I'm going to go through some of the questions that just came in. Again, I know my presentation was pretty short, but I just wanted to try and get you the most info that I could in the shortest amount of time, because I know you guys are all super busy. If you have additional questions and I'm not able to address them here, feel free to reach out to myself, your account executive here, or our individual sales team. Ashley Larson and her team can definitely assist you in anything that maybe I wasn't able to answer or that you have additional questions on. So some of the questions here, I'll just go through real quick. Are children considered for the 20% discount for preferred rating with National General? I don't believe they are. I believe they have to be over the age of 18, but I can follow back up on that. Are any of the short-term plans done with paper apps or all online? All of the short-term carriers have moved to online applications, and a lot of that has to do with them being smart applications, so that if they answer no to certain questions, that maybe they can't move on and applying because they know that's going to be a decline. And it just leads to faster turnaround. So no paper applications on the short term. Is Cigna network strong in Nebraska? Yes, it is very strong. You can go, if you're working with NatGen, when you go to run the proposal, you can actually look up the doctors, but it is a very strong network here. How do we get played for Cleverrx so that we get paid? If you are interested in the Cleverrx program, please reach out to our individual sales team, and we will get you set up with your own personalized link and QR code so that you can then start sharing that with your consumers and start getting paid on that. Somebody was asking about Oscar for both on and off market. I don't have that answer. I apologize. That's why I was dodging this question, but I will definitely find out if they're selling both on and off exchange. I know in some of the other states they do a little bit of both, but I'm not exactly sure here in the state of Nebraska, so I will find out for you. Is there any other questions you guys might have? If so, if you want to type them in on the right-hand side. Again, I can't thank you guys enough for taking 9 to 2:37. I get you out of here a little bit earlier than I thought. But we just felt that this was a great time to get everybody together. Instead of having to attend 3 or 4 of these at 2.5 hours a piece, we kind of wanted to give you a condensed version. I apologize. Some of the carriers did not have some of their plan grids available. And of course, nobody wants to commit to comp yet because nobody wants to be the first one to announce comp. But as soon as we get that, we will definitely get that over to you guys and out in your OCI account. Let's see here. Outside that, I missed answer on paper apps. Nope, no paper apps, Dennis. So outside of that, guys, I will let you be on your way. Feel free to reach out to me or my team, and enjoy the rest of your day. Thanks again.